Hey coders, does a patient on anticoagulation therapy automatically mean you should code a chronic DVT or a coagulation defect? Many coders get this wrong, so let's break down the rules of coding deep vein thrombosis and make sure that you're getting it right. So first of all, what is a DVT? DVT, or deep vein thrombosis, is a blood clot in a deep vein. If this clot breaks off, it's called an embolus. If the embolus travels to the lungs, that's a pulmonary embolus, or a PE. DVTs are diagnosed through imaging such as venous Dopplers, venography, CT, or MRI. Treatment often includes anticoagulants, thrombin inhibitors, and compression stockings. When coding, always select the most specific ICD-10 CM code. Here are some key questions. Is it acute or is it chronic? Is it recurrent? What exactly is the location and laterality? Now let's talk about anticoagulation therapy, because that's where the confusion really happens. A patient on long-term anticoagulation therapy does not automatically mean the patient has a chronic DVT or a coagulation defect. Here's why. Anticoagulation therapy is a treatment, while a DVT is a medical condition. These are two separate things that must be clearly documented by the provider. A patient may stay on anticoagulants for a current DVT, for a chronic DVT, or even just as prevention after a historical DVT. The goal of anticoagulants is simple: thin the blood and prevent future clots. But remember, anticoagulation therapy should not be coded as a coagulation defect. Let's look at some examples. An example of a historical DVT. Patient presents to the outpatient clinic for an INR check. An ultrasound 4 weeks ago showed no evidence of a current clot, but the patient remains on prophylactic warfarin therapy. Here you would code Z86.718 for a personal history of a DVT and Z79.01 for long-term use of anticoagulants. An example number 2 is a acute DVT. Patient is seen for an acute deep vein thrombosis of the left lower extremity. Warfarin is started as treatment. Here you would code a code that would support this acute DVT, and that would be I82.402. Our third example is a chronic DVT. Patient has chronic DVT of the right femoral vein and is currently being managed by warfarin. Here you would code I82.511 for chronic embolism and thrombosis of the right femoral vein, plus Z79.01 for the anticoagulation therapy. So remember, coders, anticoagulation therapy is a treatment, not a diagnosis. Don't assume a chronic DVT unless the provider clearly documents it. Always capture location, laterality, and acuity for the most accurate and compliant coding. Stay sharp, coders.